When all these tests are done, we will know if you're a high-risk mommy. High risk means you will have some treatment according to how that pregnancy is. If you are developing diabetes, hapa mbele diabetes inakutafuta, they'll capture it very fast. Hi guys, welcome back to the MAMATOTO Lounge. Remember, here we learn and unlearn all matters parenthood, pregnancy, lactation, breastfeeding, delivery, anything parenthood, beautiful, ugly, and in between. But by the end of the day, we do a lot of learning and I am unlearning. I am Shikari Rosemary. I am a registered clinical officer. I am a birth doula. That means I am a labor companion. You go whatever hospital you want to go, and I'll be there to accompany you as your labor companion. I'm a lactation specialist as well, and I'm a childbirth educator. And since not all babies bounce, I position myself to offer perinatal bereavement care for parents who've lost a pregnancy or one parent who has lost the wife during giving birth, or even generally the whole family because they're equally affected by that pregnancy loss. I have a whole 10 years plus experience supporting mothers in different services. Our offices are in Silver Plaza in Kisumu, door number 7, first floor. And yes, do not feel left out. We happen to offer virtual support, same quality classes, and you can get them at the comfort of your city, at the comfort of your seat, anywhere you are in this world. We can walk this journey with you. May it be breastfeeding challenges, or you do not want to wait for the challenge, but you want to prepare yourself for breastfeeding. Is it about the childbirth classes? We are here. So always contact us. We are ready to walk the journey with you. We have been looking at the first 1,000 days of babies. Have you watched all our videos? Here we are. Today, this is a very special request from a parent who asks, why, when we go to clinic, apart from the many questions that you guys ask, you must get blood from us. What are you looking for in that blood? So, to our subscriber who asked that question, thank you. Keep influencing more people to subscribe, to share, and to reach out with those comments. So if you are new here, karibu sana, and today we are going to discuss the antenatal profile. So, when you went to the clinic for the first time, I know they asked you for your urine, they asked you for your blood, and they tested a lot. It is quite unfortunate if your care provider did not discuss the results with you. Some of us, for a reason or the other, which is bad manners by the way, my colleagues usually look at the results, and if there's nothing negative, they're like, oh, okay, hii yote ni sawa, endelea kumeza IFAS. I think that is why the subscriber asked, why do you do all those results? Because she feels they did what? They took the blood and they took the urine, but nothing. She was told nothing. So, I am here to encourage parents. Remember to ask. Ask about the results. Discuss the expected results. And if yours is beyond, is it within normal, just engage your healthcare workers. Some of the facilities, I know there are a lot of mothers. So if everything is fine, nothing will be told. You just be told you are good to go. If they find anything that is negative or questionable, that is when they tell you, by the way, we found this in your urine and we are giving you this antibiotic or this or do this, But yeah, we should do better. So what are the obvious things that to expect, especially on your first antenatal clinic. Apart from the mini Maswalia clinic, they will also take blood. And in this blood, this is always our reference book. I will not put this book aside. This is always our reference book. So, number 1, the HB. Here we go, is the profile, the clinic profile, antenatal profile. So the HB. The HB looks at the level of your blood. What is expected? If you are pregnant, we expect you to have nothing less than 10.5 or 11. Below is a no. That is blood. And you realize the more you carry your pregnancy, the more we're expecting more. Can you imagine your body, how hardworking it is? And this baby must be given blood by your own body. So your baby is forming, growing and developing. Your baby will get blood from you. You know, every part and organ of yours is very active. There's even fluid retention. We expect your heart to keep pumping, and we have to expect you to have more blood. At the same time, we are preparing for birth. That means during birth, there will be some blood that will be shed. During healing, we expect you to have this blood to help you. And during breastfeeding, we expect you not to be anemic, because if you are anemic, you'll not, anemia is low blood. If you're having low blood, you'll not be able to provide enough or sufficient milk for your baby. So the HB test is done for us to be able to know where is your blood level. So if you're anything 11, we will not even discuss, but I apologize that we should be discussing and telling you your blood level is at 12. Congratulations. Keep eating your leafy, green leafy vegetables. Keep eating your liver, your red meat. You know, that is very, very good. And yes, keep taking your IFAS, even if your blood level is at 50. So that is the HB. I hope that is clear. Then number 2, in the same blood sample that was taken, we will have to get to know your blood group. Why your blood group? And do you remember the blood groups? You could be A, you could be B, you could be O. Then in those, we have the rhesus. You could be A positive, A negative, B positive, you know, O negative, O positive. So we want to know what blood group are you and what rhesus. The rhesus is now the positive and the negative. Where are you? Why? To help us manage your pregnancy and any eventualities if you may need to be transfused. And a little bit more, it is good to know your spouse or your partner or the father of this child. It is equally good to know his blood group and rhesus. So if you know, and if your spouse or the father of your child, this current child, is negative, please remember to discuss it with your healthcare provider. And then, in the same blood, we may do a random blood sugar. Or you might be pricked a little here, and a stripe is just taken to check for the random blood sugar. We want to rule out diabetes, because there is a measure. If you've just taken a meal, and somebody who took a meal the last 2 hours, and somebody who has not taken any meal the last 6 hours, we call it fasting, all those blood glucose levels are different. So once we know the glucose level and the duration that you have taken, if you've just taken a banana like 30 minutes ago, and the glucose level is high, that one we expect. And maybe to rule out anything, we may ask you to come back to the hospital tomorrow when you've not taken anything and we do a fasting. We want to know, are you diabetic? Or are you pre-diabetic? And manage you accordingly so that we do not risk anything, especially to you and to your baby. That is why you'll see us doing a random blood sugar, then a fasting if need be. Now that one is at your care provider's judgment if you need a fasting. Kindly note, very good hospitals, I call them very good because I give them points. They might do random blood sugar or fasting blood sugar every time you visit. So throughout your antenatal care, they will have to do a urine test and a random blood sugar before you see your obs-gyna. That is the ideal. That is the most recommended practice, which I'll give a reason. It's because they want, if you are developing diabetes, upper mbele diabetes in kutafuta, they'll capture it very fast. Same as urine test. The urine test, I'll talk about it because I've mentioned, let me just talk about it. The urine test has so many things that your doctor is looking out for. And maybe you'll see, if it was done, there's like a white bracket like this and then it's written nil. Nil. So all those parameters, if they are nil, you are good to go. If you don't have proteins, if you don't have pus cells, the urine tells us a lot. It even gives a hint of how your kidneys are performing. And if the doctor sees something in the urine, more tests may be done. That is the time they may discuss with you. They may start discussing about hypertension. They may start discussing with you something to do with, can we do a kidney test? But these are bare minimum, like your first antenatal. So for each and every positive result, we'll communicate to your doctor to dive in the next. And your doctor wants to find out, so what, until you get the right treatment. Hoping we are together. Then, the next thing here that is written is TB screening. TB screening, you might hear the doctor asking you some questions, and please just be very candid. We talked about integrity when it comes to your health. Are you coughing? Have you been coughing for more than 1 month? Have you lost weight? Have you lived in an environment where there's somebody who has a chronic cough for more than 2 weeks? Are you having night sweats? Those are obvious indicators towards TB. And your doctor may ask you that. That's why we call maswali mingi ya daktari, maswali mingi ya clinic. There you are. They are just trying to find out, do you have TB? And if you have TB, can it be managed so that it does not affect your health and the health of your baby thereafter? Then, HIV test. Very important. Very important. Basic reasoning, we want to prevent your baby. We want to reduce the chances of parents transmitting HIV to the baby. So yes, we will do a test. If mommy is there, we'll do a test to mommy. If daddy is there, we'll do something that we call a couple testing. So we'll test you as a couple. But if the father is not there, you'll be requested to bring him next time. And daddies, it's very good to accompany your pregnant woman to the clinic. Please do, not only for the HIV, but also for so many other things and emotional things that we've already talked about in our previous discussions about the first 1,000 days. You'll also be tested for syphilis and other STIs. If it's positive, you'll be treated and you'll be tested again thereafter just to make sure that it has cleared. Then, the obvious. Daktari, nitafanya lini ultrasound? Mothers ask me when they come for the childbirth classes. Shikari, should I do an ultrasound? So, I know we are all very expectant. We are very pregnant. And we want to do as many ultrasound as we can. But what is the bare minimum? Bare minimum scans we want are just 2 to 3. Depending on when you've come to clinic. We still insist. I still tell you as MAMATOTO, go to the clinic the moment you found or the moment you think you're pregnant. Please go to and start your antenatal clinic to make sure all these tests are done and to avoid any malformations of your baby. So, first ultrasound is done the moment you go to the hospital as the first. And this could be anything below 15 weeks it will give us at least an estimation of your date of delivery and how your baby is forming. Then after below 24 weeks, that is 18 now weeks to below 24 weeks, we call it anomaly ultrasound. It's going to look at each and every structure of your baby, because by 20 weeks your baby is well formed, 18 weeks your baby is well formed. The sonographer can see these are the nails, these are the two small little fingers, this is the backbone, does it have any issues, these are the beautiful two limbs. So we call it anomaly, just to look out for anything that is out of the normal. It's a very important ultrasound and it's very good to do it. And then from there, you can do a third ultrasound in the third trimester, when now we want to see how big is this baby, how functional is your placenta, what is the weight of your baby, how is your baby presenting, is your baby ameketi tu hivi mapozi zake, ama amekuja na kichwa, ama amelala along, is there a cord? So many things that we look for in preparation of delivery. Kindly note, when all these tests are done, we will know if you're a high-risk mommy. High risk means you will have some treatment according to how that pregnancy is, just like the word high risk. High risk is more of a special mother. I know all of us are special, but there are some mothers who have some medical conditions, and those are the mothers that they go every 2 weeks to the hospital. They will do extra ultrasounds. All right. So if you are in high risk, definitely your ultrasound will not be bare minimum. There will be when need be. You may also not be a high risk mom, but there is a need for an ultrasound. That one, definitely your healthcare providers will let you know. But we have said bare minimum at least 3. However, there is need. Anytime there is a need, you will be sent. And for you, mommy, I know you want to know the sex of your baby. That one is not medical, and we are not putting it at part of bare minimum. So that one is others. And yes, I know ultrasounds are not very intrusive. They are not risky. So I know mothers and fathers will want to have like a photo shoot, if I may call it a photo shoot, of ultrasound of month 1, month 2, month 3, month 4, until baby is there. There are also so many different kind of ultrasound. Some are up to 3D, 4D, that you can even identify mtoto anafana babake ama mamake. At least you can see your baby even before you're born. The baby is born. So yes, those are ultrasounds, and the variety is wide according to your pocket and your need. So ladies and gentlemen, families, I wanted to answer one of our... Thank you so much for asking that question. Hiyo ndio maswali ya clinic, na hiyo ndio vitu kwa clinic yenye tunatoa. We do a screen for you to make sure you have had a healthy baby. You see, that is how friendly MAMATOTO is. You ask, we give you. You seek for it, we serve it to you. That is one of our many subscribers who asked, could you let us know about this demo they took? Where did they take it? That means she didn't even get her results, but they are written somewhere. That one I know. Until next time, thank you so much. Please keep subscribing, keep sharing, put this comment section as busy. We are here to answer you. When you want a private session, visit us, write to us, call us for a private appointment. Thank you so much for our production team. We couldn't be here. This could not be in your desks or in your devices without Chanuka Studios. Engage them to help you create all your memories, whatever, whether photography or videography. Their offices are in Kondele Estate, Kisumu. Feel free to reach out. Until next time, this is the MAMATOTO Lounge. Bye.